number of materials, the next one, a number of materials that refer to basic information about the virus, the safety of the patients in accessing their clinics, their departments, in answering some common questions to our people, and in providing what information is available to date on the infectiousness of this virus with regard to transfusion transmission, on what we feel we should do in providing enough blood for our patients. Very important to be kept well transfused, well chelated. It's very important to address infection with this virus. So we have all the material that we feel are necessary. Myself, the staff, and our medical advisor are continually trying to update and put new information in this material so that you don't have to look for material, you don't have to look for information. Look for TIF's material, give us your information to update it if necessary, and all the patients should be well aware of the material so that they keep well informed. The other aspect of our information has gone through social media website, and our website is as informative as ever, I believe. And the other important issue that we are focusing on is to collect information from all over the world to see how this virus has clinically impacted or will impact in future on hemoglobinopathy patients, thalassemia, and sickle cell disease. For sickle cell disease, we more or less know and are known the great risks that this infection, the respiratory orientated infection, will cause. But for thalassemia, is not known, so we are desperately collecting material from those patients that have been confirmed as being infected. We know that the two pillars of that are affected, one is shortage of blood, and you see some percentages that I'm showing that from previous webinars and from reports, a lot of people are reporting shortage of blood. Due to the shortage of blood, a fall in the pre-transfusion hemoglobin. Some of them report severe shortages, some report moderate, and a small percentage report that we are still have adequate supplies of blood. Some people report that they have addressed this shortage with developing family and friend donation practices. Some have informed us of being given all the blood or whole blood. I hope this is in a very, very small percentage of the patients. You will tell us your stories and we will enrich our information. At the moment, we have the next one. At the moment, we have information that there are about 50 patients with thalassemia being infected with the SARS-CoV-2 virus. The greatest majority have recovered. Some of them have been hospitalized but have recovered and have come out. We have only been reported from these 52 deaths. So we are very hopeful that this infection will be as mild as possible, but there are so many unknown facts about the clinical impact of the virus on any clinical substrate and any clinical disease that we can never rest assured. We must keep in touch with every patient. The treating physician must be alert all the time because we are not very secure on how it develops. At the moment, the results are, the information we have is giving us hope that perhaps thalassemia is not a condition that makes these patients considerably vulnerable. Vulnerable to a certain extent they must be, but not considerable, I hope. Only collection of knowledge, experience, and data will give us this information. Therefore, we very much rely on what we discussed today. Having said that, I give the floor to Michael Angastignodis, the medical advisor, and yourselves, the medical experts, will give their insight and then interactive discussion. And thank you once again for being with us. We rely on your help in collecting information. This is the only way where we can guide our actions and assess what is most effective for our patients, the patients we represent. Thank you so much.
Hello, everybody. First of all, want to say good morning or good afternoon, because for some of you it's already afternoon, and really to start a little bit of a discussion with the doctors first. One of the concerns of patients, and we're going to hear from the patients a bit later, one of the concerns which is causing a lot of anxiety is the possibility of shortages of blood and not being able to get the blood transfusion in time and having to drop the hemoglobin level with the consequences that we know. I don't know basically how each country is experiencing this. And I know that Professor Hassan Abbas Zahir, Professor Zahir of Pakistan, is actually particularly focused on blood transfusion and the quality of blood and the adequacy of blood. And I just wanted to start with him and ask about his experience, and at the same time, what kind of advice he would like to give to everybody else. Professor Zahir, can we hear you?
Is it muted?
Okay.
Next one.
I saw that
he has to unmute. Can you tell Dr. Zahir?
Can you write?
Dr. Zahir?
Oh, yes. Yes.
Okay.
Can you hear me now?
Yeah.
Yeah, sorry, we can hear you.
Yeah.
How are
Thank you very much. Thank you very much, Michael, and thank you for inviting me to this webinar. And just call me Hassan. A couple of disclaimers. I have retired from the government service a few weeks ago, and so I do not represent the Safe Blood Transfusion Program anymore. I am now currently working as the advisor to the chairman of the Pakistan Red Crescent Society. And they have transfusion services, some centers, and I'm trying to strengthen those services. The second thing is that I'm still in touch with a lot of thalassemia patients who I know, and some others also through Facebook. And so there are some peculiar issues facing some of these patients that I would like to highlight here. The general issue that all the patients have been facing in the beginning especially was the sudden decrease in the number of donors. So there was not enough blood available in the blood centers, and there were a lot of appeals on the social media. And then apparently there was quite a good response from the society. But it remains to be seen how well the individual thalassemia centers managed their inventories and how it is going to unfold from now on, because next month we have the month of Ramadan, in which traditionally, blood supplies are, again in short supply. The second thing was that since the last 2 years, we have been working with the social media giant Facebook, who had developed a Pakistan-specific feature on the Facebook for mobilizing voluntary blood donors in Pakistan. And for various reasons, mainly for lack of resources, we had not had the success with this feature as much as we would have liked. But during this pandemic, we have witnessed that quite a few of our centers who were struggling with this feature have now reported very good results, and they are able to mobilize voluntary donors through their Facebook feature now a lot. So this has been a blessing in disguise for us, and it now proves for a fact that this feature is very much workable. And in the new era, the post-COVID era, I think digital technology and the social media will have a lot of role in all spheres of our life, including this work. Another thing that I would like to highlight here is that I know a couple of thalassemia patients, and Michael, I think you also know them. Yeah, of course. One of them was invited by TIF in Cyprus a couple of years ago. His name is Jatin from Karachi. And he, along with another patient, Ahmed, these are two patients who are financially very well off, and they used to get their treatment in Dubai as private patients. I'm sure they are not able to travel now, so I was concerned how they are managing these days. There's another patient, Pakistani patient, who is based in Dubai. His name is Sohaib Azam. I met him in Saloniki in the last conference. And in January, I was in Dubai, and I met him. And he's a businessman, and he was receiving excellent medical care since the start. And now with the businesses going down, I'm also concerned about whether he will be able to continue living in Dubai, and if he has to come back to Pakistan, he will get treatment which is not as good as he's used to. So these were some of the issues that I think are peculiar to Pakistan.
Yes, but Professor, can we have your experience, whether you know the infection of thalassemia in Pakistan? Do you know of infected thalassemia patients there, and how many, or no?
No, I'm afraid I don't have that information. In fact, no one has that information because no one collects or coordinates with all these thalassemia centers. And the centers are basically, to a large extent, working on their own and not interacting or exchanging experiences with each other.
Yeah. Is it possible for you to coordinate and give us in the future, maybe next week, numbers? Can you contact some colleagues to give us not only some numbers, but also how the virus
Hello.
Thank you so much. So the next one is Dr. Khan or Professor Khan?
So, Khan, shall we go to India now then and ask some of the doctors there? Professor Hanna, you are, I hope you can hear me. What is the experience in India, both on patient and also on the availability of blood?
No.
If Dr. Hanna is not there, Shobha Tuli is there, and what about Dr. Tuli Kasher?
The cannot hear us.
Hello?
Yes.
Hello?
This is Dr. Tulekar.
Hello, can you hear me?
Yeah.
I'm VK Khanna.
Yes, Dr. Khanna.
Okay, let's start with Dr. Hanna. How about the situation in India?
Yeah, in India, I would say that since this crisis started, in the cities, big cities, people have been managing. But the more problem is in smaller towns and in far off places, remote places. Even in big cities also, there is shortage of blood because of, as Doctor just now said, that there is shortage of blood because of lack of donors. And initially there were hardly any donation camps. Now they have opened and few camps are being organized. And then our patients, those who come from outstation, they are also finding difficulty in commuting because of the lockdown. They cannot travel, especially those who are dependent on public transport. So they are finding difficult to come to our center. Like in our, I'm giving example of our center. I'm sure in all other centers also people are coming from outside Delhi also to get the blood transfusion there. As far as I know, that in remote places there is a lot of problem about the donors. Donors are not coming out, not volunteering for donation. First, there is fear of going to the hospitals. They fear that they might pick up COVID from there. Second, because of the lockdown all over, they don't want to go through the process of getting those curfew passes and then going for donation. They feel that they'll donate it later. But in this, I would say that our thalassemia associations are playing a very major role in motivating these donors and getting them to the donation centers, because most of the places nowadays there is in-house donation, and people are now they are coming forward and they are donating. Most of our patients are getting donors with them and they are donating. And the third problem, I would say that in India, because these chelators are available from the societies, they are not available in open market with the prescription. So they are either available from the company's stores or from the societies. So because of the lack of courier services and transport, public transport especially, they are finding it difficult to procure these medicines also. But gradually over the period of time, we are getting over it slowly. And I hope that once this lockdown is over, we'll get over this problem.
Okay. Any knowledge or experience on infection in thalassemia patients, Dr. Khanna?
As far as I know, I have not heard of any thalassemia patient.
Okay.
Especially in Delhi, there is no case.
Okay, thank you very much.
Dr. Chulika?
We are taking all precautions, like we are maintaining that social distancing. People are coming with the face covered with the mask, and then we have given them sanitizers also in the ward, and they are taking all precautions. We even those who are admitted also, we are getting their COVID test done.
Yeah. Okay, thank you.
Dr. Chulika, do you have what would you like to add about the situation in India?
I think I agree with most of the things that Dr. Khanna said. I hope I'm audible. Hello?
Yes, madam.
I'm audible. So the only other thing I wanted to add was that we've seen 2 cases of alloimmunization because they were transfused at a local hospital. So the quality of the blood supply in all the hospitals, especially the smaller cities, is not always so good. We were very lucky that we'd done a big camp just before the lockdown. So except for just the last 2-3 days where we've had a dire crisis of certain blood groups, otherwise we've actually not had a shortage. But the mobility makes it difficult, as Dr. Khanna said, to get the medicines and to come to the big city for transfusions. And as I said, the alloimmunization part is serious. We have not had any reports of thalassemia patients, fortunately, with COVID. We've unfortunately had one hemophilia patient who had COVID and died in another part of the country. But so far, I think our patients are thankfully safe. Thank you.
Okay, thank you very much. Thank you.
Mm.
These are very important points that are very relevant to big populations in big countries, like public transport to access the public transport, to go to the thalassemia specific centers, and hence serious immunizations from the quality of blood transfusion given. These are very important points in the big countries. Of course, it's hopeful the fact that in such a big country we do not have any reports of deaths due to the coronavirus. Let's hope that somehow thalassemia is being protected. Perhaps blood transfusion is an area where we have to look for giving coronavirus a real shutdown in such patients. We need to gather information to be sure. Thank you so much, both of you from India.
Is Mrs. Tuli there? Mrs. Tuli?
Unmute, ask her to unmute.
Can you hear me?
Yes, we can now. Yes. Hello, Mrs.
Can you
Julie.
hear me?
Yes,
Hello?
we
Yes.
can.
Yes, we can hear you.
Yes.
Okay. Okay. I will not repeat what Dr. Khanna and what Dr. Tulika State has said, but just taking 3-4 minutes from you, what I want to add is that apart from whatever the commendable services that our doctors and the hospitals have been doing for this in this difficult situation, the role played by Indian Red Cross Society, where they have managed to arrange transportation to go to the donor houses, to bring them in to donate blood, and then now started with just 2 days back, starting with the blood donation camps, where their blood collection van is also stationed in some of the busy streets, and the donors come in because we inform them through our social media about the organization of this camp, and apart from that, whatever, through the social media and by making phone calls to the ministers, to the health secretaries, the Delhi government and the central government, our health minister came on the TV and assured that there will be ample blood for our thalassemics. So that is a very big achievement that, we have made it here. And apart from that, the recently, as I informed you, that the Ministry of Health and Family Welfare, Government of India has issued the directives also, and which mentions clearly about thalassemia, that there should be enough blood for them in advance, there should be chelators for them. So all that guidelines are there in the directives, which are being now sent to all the states and for the district hospitals. So this is something very big achievement that we did it in the just 3 weeks of time through our communication, positive communication with them. The few problems, apart from what Dr. Khanna and Dr. Tulika have mentioned, that we are concerned that because now I think the courier service will be opened within by 20th of this month, and we'll be able to send the medicines to our children who are living in the other parts of the country, and so this is manageable. But some of the reports that I get from outside Delhi, like from Bihar, Jharkhand, and smaller places, where they have to travel to get their blood transfusion. So that's another issue, that their hemoglobin has dropped to 5 and 6, and they are not able to reach to their hospitals. Apart from that, I came across 3 cases where the women are pregnant now and they want to come to Delhi for getting the CVS test done. And she is in the 10th week of pregnancy. So she is very much concerned that how, because of this lockdown, she will miss this period and she may give birth to a thalassemia, bear a thalassemia child. So these are the few still, in spite of the small blood collections, there is still shortage of blood, fresh blood especially. But we are trying to overcome, and we are keeping our fingers crossed that there should not be, there's still no death due to COVID, in our country, apart from what Dr. Tulika has said about the hemophilia. So still, some challenges are there, but we are trying our best here to manage, because that India is a huge populated country and the huge number of thalassemics are here. And that's all. And of course, the guidelines which TIF has prepared, we have been, forwarding it to all our members. So that has been very helpful.
Thank you very much, Mrs. Chuli. Your comments have been also very helpful because they made us realize that also prenatal diagnosis at the appropriate pregnancy time, may be missed. And okay, but let us hope that this will really end up sometime before there are many tragic consequences. Thank you so much. Ramadan doesn't affect you, but no. Ramadan, big distances in accessing drugs, accessing transfusion centers, and all that is really a problem, particularly in your country, in large populations. And okay, thank you so much, and keep safe. Thank you.
Okay, what about Professor Bhattacharya? Kolkata is maybe.
Hi, good evening. Hello. Hello.
Yes.
Can you hear me?
How are you?
Yeah. Hello. Yeah. I thank TIF for this webinar. Actually, we in West Bengal, we have a very well-structured thalassemia control program. So initially there was a setback. We couldn't know how to manage. Now what we are doing is that we have 34 centers and around 25,000 patients registered. So all the medical officers and counselors are tracking all the patients. Phone numbers are with us through either phone call or WhatsApp group. And whenever the patient is having any problem, they have been asked to check the hemoglobin level from the nearest local lab. We have reduced the transfusion threshold. Once this is most of the patients are E beta thalassemia. If it's 5 gram%, or if the patient is symptomatic, then we are planning for transfusing them. So patients are discouraged to attend OPD, not even a routine daycare. So what we are doing is that any patient requiring blood transfusion, we are sending these to the blood cell. And blood cell is guiding the patient to their nearest blood bank where the blood is available. So by this method, this is a very well coordinated method we have started already. So all the patients who are actually in need of blood transfusion, they're getting their blood. And initially there was start of blood unit. But now in West Bengal, the police, even others are donating blood. So that the blood has to some extent has made up. And now we are able to give blood transfusion to the patient whomever is requiring blood. So that is the good thing what we could achieve now. And all the patients are, another part is that a psychiatric problem also is there. They are confined in the house without any contact with the physician. So counselors are counseling through phone and WhatsApp regularly to all the patients, and they have been instructed if they have fever, a cough, any symptoms, to contact the nearest fever clinic. And what we are doing is that we are working in government institutes. So patients are getting the chelating agent from the government hospital. So we are asking not the patient, but the patient's guardian or the relatives to come to the hospital to take the medicine, and we are distributing 3 months medicine to them. And whatever is their problem, they can contact the counselor and the medical officer at any time, and we are trying to solve them with that. So with these, I think now it's a stable situation. Though the OPD is open, they can come to OPD, but we are discouraging them. So we don't want them to come to the hospital to get exposed to many persons. So by this, I think by this WhatsApp telephone method, coordinating with the blood cells, we now are able to manage the patient to some extent, like they are well here in West Bengal. Until now, we have not come across any patients who have been infected with COVID. Like till we don't have any information.
Thank you very much indeed. It appears that you put a very structured way of addressing the needs of your patients. But can I just clarify. You said that transfusion is essential when their hemoglobin reaches 5 grams or lower, and or they are symptomatic. Have we reached the stage where you have put a threshold of hemoglobin 5 grams before they are transfused, or have I heard wrongly?
What? Hello, can you repeat? Hello?
Yes.
There is a connectivity issue. I couldn't hear you. Hello?
Okay, may I repeat? Can you hear me now?
Hello?
Can you hear me?
Yeah.
Okay, I'm not sure. First of all, well done. I think you have put forward a very structured strategy for the patients, you know, reaching out to them by phone, giving information on the phone, accessing their drugs in the hospitals. But have I heard correctly, you are transfusing your patients when they reach 5 grams hemoglobin, or they feel symptomatic, or have I heard wrongly?
Yeah, like, you know, E beta thalassemia patients, they can tolerate a low hemoglobin. So this is mostly symptomatic, but normally we are not allowing to go below 5 gram %. But if they are symptomatic, even at a higher level, then we are giving a blood transfusion. And already many studies have proved that E beta patient can sustain on a low hemoglobin level, even a 5 gram hemoglobin level, they are not symptomatic. But if a patient is symptomatic, then we are not considering the hemoglobin level. Then we are giving it.
So may I interrupt? So you are mostly talking about hemoglobin E beta, or you're talking about beta homozygous thalassemia?
No, this is like in my part, most of the patients are E beta thalassemia. For if it's a B homozygous, then of course the hemoglobin should be a higher level.
Okay, thank you so much. Thank you. End of the story. Thank you.
Thank you.
I have clarified my question. Thank you so much, everyone from India. Can we call Professor Vip on the platform? Dear Vip, are you with us?
I don't think he's in. No.
No, he's not in. So who is the next patient?
Let's start by country.
Now it's patient's time.
Patient's time. Please stay with us to see what interaction with our friend patients. Ella Michael. Yeah. Thank you so much, everyone.
Okay, from our patients, who is online and what would they like to ask or discuss? There is somebody from Thailand. Since Vip is not with us, what about Omar Avede Sonso from Thailand? Are you with us? We need to know what Thailand is doing, because
Yes. Citizens must mask before leaving the house. Before leaving the house all the time. Do not leave the house after the specific time. Yeah. And no patient coronavirus. Yes.
Μιλάτε εσύ, δεν κατάλαβα.
We didn't understand, or we have interruption with the voice.
Yeah, we were getting Omar Avede. Can you hear me?
Just better to bring the microphone near to him.
Because we lost a little bit of what you said. There were interruptions. Could you repeat what you said?
In Thailand, not thalassemia, not with coronavirus in patients in thalassemia. No.
Okay. So you have no blood shortages. You don't have any people infected in Thailand in thalassemia patients?
Yes.
Mm-hmm. Okay. And what about Kayasit? Is Kayasit online?
I think I'm not your hospital, I don't, I don't, I don't, I think so. Do not in hospital. Doctor no.
All right. Okay. Kayasir? Okay. Shall we go a little bit to Nepal? Is Durga online? Durga Pathak, are you with us?
He's in, yes.
He's in.
Yeah, can you unmute your microphone, please, Durga?
Yes. Yeah. Yes. Good afternoon from Nepal.
Good afternoon, Durga. You always had some difficulties, and we heard that the thalassemia center was closed. Is that correct?
Yeah, we did close our thalassemia center because we have only 6 beds and more patients every day, more patients coming every day, maybe 14, 15 patients for blood transfusion. So we found a bit risk to transfuse patient in so crowdly. So we decided to do transfusion in a hospital very close by our thalassemia center. And if we don't get necessary blood from blood bank, then we can get blood from that hospital also because they have blood bank too. So we found that maybe the best way to use this time until we have this lockdown. So we are doing at a private hospital at now. Hello? Hello? Yeah, can you hear me? Yeah, can you hear me?
We didn't. Yeah, there is interruption. Yes.
Oh, sorry. Yeah,
Hello.
let me repeat again. Because we have
so,
on. Yeah.
Yep.
Yes, please.
Continue.
Yeah, because we have a limited bed available for patients, and the patient we have, we are getting more than bed we have. So that means it becomes a bit crowded because in one bed we have to put 2 patients. So we found a bit risk to transfuse 2 patients in one bed. So we did decided to go to private hospital because we don't know. I mean, a patient maybe they have corona or they don't have corona, or sometimes parents with patient parents also coming. So we find a bit risky to do transfusion in our center. So we decided go to private hospital, and also this private hospital they have blood bank, and because this time blood donation is very limited. So if we don't have necessary our essential blood group from blood bank, then we can get blood from this private hospital where we are doing transfusion. That's why we choose to do transfusion in that hospital.
But Durga, does this private hospital require payments? If so, who pays?
Yeah, they do. I mean, they do. Okay, actual their charge is 1,500, which is about $14. But we did request, so now they are charging us $5 per bed. So 1 day transfusion, they do charge $5. That's it.
Okay, and who's paying? The patient?
Okay, at the moment, I mean, parents are paying, but later we decide what to do, how to do, because we have not decided for payment because we can't do meeting right now. So Right now, our target is just to maintain their hemoglobin level, whichever way, and then later we decide.
All right. And what hemoglobin level are they being transfused at? Do you know?
We always try to put above 9.
Above 9. Oh,
Yeah.
Perfect. Thank you.
Okay.
Thank you.
Thank you, Durga.
Thank you, Dr.
It looks as though things are under some control, at least in Kathmandu.
Yeah, it's under. Yeah,
Do you
it's
know?
under control, and yeah, it's under control.
Do you know outside Kathmandu if there are problems?
Yeah, I mean there are problems outside Kathmandu, but what we are doing is we have told to all parents that whenever they have problem to get blood, please call us. So we find donor for them. So that we are finding donor, sending to blood bank. They are doing donation for our thalassemia patients, and that blood they are receiving. So it's a bit difficult, but somehow it's we are managing.
All right. Thank you, Durga.
Thank you, Dr. Michael. Thank you.
Okay.
Indonesia.
What about now? Who's next?
Maria, Indonesia. Maria Natasha.
Maria.
Yes, hello. Hello. Sorry. Okay. Hello. Can you hear me?
Yes, Maria, we can hear you.
Okay. So the situation in Indonesia, we also have the lacking of blood bags, and also because of the lockdown, people are afraid to go out to do blood donors, and we need to find our own donors before we do transfusion. And
can you repeat, please, because we didn't hear you well.
Hello.
Yes, yeah. Please repeat what you said, please.
Okay. In Indonesia, we also have lack of blood bags, so we need to have donors. Hello. We need to bring our own donors before doing transfusion.
Okay.
Oh, so you've gone back to a kind of replacement system in the bank, yeah.
Not the replacement, but because there are in the Red Cross Society and also in the blood banks are lacking of blood, we need to bring our own donors like 2 days before the transfusion, like that. So yeah, we have our own donors before that. And
does this make life difficult for the family to find donors, or do you find donors easily?
We do have some difficulties in finding the donors, but our community in Indonesia have doing a campaign of blood donors, and we are doing also collecting database for the one who wants to donors. And when our friends, the patients from Indonesia needs to have blood transfusion, we can contact the donors from our database. So we are bridging them to have the donors, to find the donors to make them easier.
Okay, Maria, this is interesting in Jakarta. Is it the same in in your vast country with so many islands? Is it still possible to find replacement donors, to have a database?
So far our database only for Jakarta, Tangerang, and the surrounding the little city surrounding Jakarta. But outside Java Island, we doesn't know about that. They still need to find their own donors. Like through social media, through maybe there is also organization named Blood for Life, who can help us to find donors.
Okay.
Mhm.
All right. Do you know? Do you have any thalassemia patients infected with the coronavirus?
So far, there is only one patient in Indonesia reported with coronavirus who came to the hospital 3 or 4 days after having a heavy breathing.
Mm-hmm. Okay.
But now the doctor said that the patient doesn't have doesn't show any improvement yet, but we still the doctor still working with the patient. Hello.
Yes, yes.
So the patient is still under treatment. We didn't understand. Is the patient doing well?
The patient still haven't show some improvement, but the doctor still taking care of the patient.
All right.
Yes.
Okay.
Situation. Thank you very much.
All right. Thank you very much.
You can go back to India.
You're welcome.
Okay.
Anuba. Anuba, India.
All right. Thank you very much, Maria.
Thank you, Maria.
Anuba, are you there? Let's go back to India.
Hi, Dr. Michael.
Hello.
So good to see you.
Thank you.
We are fine. At TIF, we are all healthy, but we are keeping distance from each other so that in case anybody is infected. But so far, touch wood, nobody has any problem.
Very good to know that.
What is the patient experience in India?
So, Dr. Michael, I think these testing times have been, really good learning experiences for us. So we do face blood shortage. But what we have done is that across India, we have organized ourselves into small groups of volunteers. And we have invited not only thalassemics but their relatives also. And like somebody from Pakistan said that we are getting massive help from Facebook. Facebook team is actually hand holding us as far as donor hunting is concerned. So we are using 4 to 5 online platforms, including Facebook, for donor hunting. What we're really doing is we are maintaining register of all the patients hospital wise. So we know what is the schedule of the patient, when is the blood transfusion scheduled, and according to the schedule, we are arranging donors. So it's not that it's completely we have moved from voluntary to replacement, yes, but I don't think there is any other way to deal with the situation. So in addition to Red Cross, we have many government and private hospitals which are battling shortage of fresh blood. So these teams of volunteers are finding donors. We are also organizing transportation for donors whenever required, and wherever the patient can pay, then they pay. Otherwise, we have formed a small fund out of which we are paying, and obviously Thalassemics India is standing right behind us in this endeavor. We are also in touch with the government directly, as Tuli Aunty shared. So we keep sharing our feedback, our grievances, not only with the central government, but also with the state government. So we are writing letters to chief ministers, we are writing letters to health minister in parallel. We try to get in touch with the police wherever we are facing problems with regard to transportation of donors, or organization of donation camps, etc. Then in addition to this, we are in touch with media. There have been lots of stories on thalassemia and how thalassemia patients are facing blood shortage. So this has also helped us in getting more donors and also in keeping the government alive to our demands. And last but certainly not the least, we are running social media campaign continuously, and we are trying to rope celebrities as far as possible to make appeals for donating blood. And on the other hand, we are on a daily basis in touch with our hospitals and blood banks. So that is a very brief synopsis, and in parallel we are maintaining database of all the donors who are coming so that we can use these donors for future also.
Okay. This is interesting. From the patient's point of view, Anuba, when you go for transfusion, what is the process? Do you go straight to your, you heard from Calcutta that they are redirecting patients to the nearest hospital or to the nearest place where they can get their hemoglobin and cross-match done so that they don't have to travel too much. What about the patient's point of view? When you go to your usual hospital, that's question number one. Is there some kind of triage, some kind of assessment of the patient's condition in terms of whether they are infected or not? Are they asked about their contacts, or is it just putting on a mask? Is there more to the admission than just putting on a mask?
So I will invite my colleague Viresh to comment on the private hospital side, but at least on the government hospital side, we are just, wherever the government hospital has been declared a COVID hospital, those thalassemia patients are shifted to other government hospitals. For instance, there are a number of COVID hospitals from which we are receiving thalassemia patients to our hospitals, and we have just been told that we have to come wearing masks, and if there are any symptoms, even if they are mild, we have to report to the emergency first and then come to the thalassemia daycare center. So that is the answer as far as the government hospital setup is concerned. Viresh, if you would like to comment on the private hospital setup, how you being treated in terms of COVID?
Viresh.
Sure, Anubha.
Hello.
Yeah, hi, Michael. How are you doing? Okay. So in private hospitals, so mask is a mandate in India. Whenever you're going out, you must have a mask. So that's a mandate. And in private hospitals, they ask us to fill a form giving our travel history and any symptoms we see. And then they allow for transfusion. For replacement, we need to get the donors. So it is overall going smooth. There is not much difference, only that for entry, we need to show some documents and all. Earlier, it was all paperless things. Now, Anubha has mentioned the current situation very well, but from my side, I see in coming days, there is going to be some risks which are going to be increasing. So in India, the number of COVID positive is crossing 15,000 currently, and it will go up based on the statistics. So every 15 to 20 days, all the thalassemics will go out once, visit hospital. So I'm really concerned about their safety. They will, so as long as they're at home, they are in isolation. But when they go out, there is a risk. There is always a risk to have some sort of infection in the hospitals and all. So that is one thing which is concerning me, and we're yet to see some solution or guidelines on that part. So maybe TIF can guide us, and also to the Anti-Thalassemics India, we are also working on this. So that is something which is concerning me at this time.
This is interesting. There seems to be a differentiation in the practices in the private sector than the government sector. Okay, what about on the private sector? Do you have any shortages of blood?
So in private sector, again, we are going with the replacement method. So we are finding donors, the same method which Anva has suggested, and giving replacement. The thing is, sometimes we donate one and we receive 2 units. So there is still availability. So we are able to manage well. Some replacement is required, but if there is some problem in getting replacement, they are able to provide us blood.
And you, Viresh, have you heard of any thalassemia patient being infected?
No, not yet, by God's grace.
No.
In India, everyone is safe.
Mm-hmm. That's interesting. It's a big country, and I expected, or we feared, if you like, that thalassemia patients might be infected, but it looks as though they're keeping safe at the moment. I think thalassemia patients manage to look after themselves very well.
Yeah, thanks. Right. They're receiving the right guidance frequently to take care of themselves from society, TPAG, thalassemia. Yeah.
Okay.
Thanks.
Let's go to the Maldives. Let's go to the Maldives and hear from Jihan. Jihan, where are you?
Please unmute your microphone, Jihan.
She there?
Yeah, she's here. Yes. Jihan, do you hear us?
Hear you. Can you hear me?
Yeah.
Now
perfect.
we can, yes.
Okay. Thank you so much. And it's so nice to have this group discussion. Thank you, Tiff. And I am not a patient, as you know, and I'm representing the Maldivian Thalassemia Society. And also currently I'm working with the United Nations in Maldives as a technical consultant for the health ministry, and also giving my technical support to the preparedness and response for the COVID in general. So when we look at thalassemia in the country, so far we do not have any COVID positive patients. We have over 800 registered cases in our country, and 50% of those reside in the capital island Male, and 50% of the patients in the remote islands. So as of today, as I said, we don't have any patients positive. However, we had 2 patients who were isolated, but they are tested negative, and they were given blood transfusion in isolation as well. So all went well with that. And as far as the services for the patients, we are working with the government to make sure that continuity of services and essential services are there for the patients. And that's one of the things that we've been trying very hard. For example, transfusion, chelation, there shouldn't be any interruption. And so far, so good. It's all been taken care of. And I think the blood services is also working very hard to ensure that patients have this access to the services. And even though it's not as the timings have changed. They work limited hours, and also because of the physical distance, and they have started giving out appointments to patients. And I think this is a good move. And as the patient organization, we are also advising our patients to adapt to these management of time, management of their treatment. And as far as the blood supplies are concerned, at present, the Thalassemia Center has organized blood donation camps, and we are also helping in sending our donors and creating awareness among the donors for blood donation. So at present, we have about 1 week's supply of blood in the Thalassemia Center. This is because we do not have a major blood bank system in the country. So this is, I think, and also our patients have voluntary and directed donors. And at the moment, our blood supply is adequate, but if this continues, and we are currently in our first 24 hours of the lockdown, so this is just starting for us. And I think we will face problems in terms of blood donation and blood supplies. However, because of our small population, we are concerned actually with the arrangements are there, everything is there, but however, with the confinement and with the lockdown, we might be running out of blood, which we hope we do not have to face. And the other thing is we're concerned for the patients in the outer islands, because since the lockdown is only in our main capital island so far, because of a community spread in the main island. The remote islands, however, are not locked down, but the transportation and everything is very, very limited. And if they come to have a patient with a rare blood group, that will be something that is going to need attention as soon as possible. But we are also working with the Ministry of Health and with the services there. We hope that we'll be able to attend to it, but the I don't know how this is gonna go and how far the spread is gonna go, but we are taking all the preventive measures for now, and that is what we have from our side. And also one of the concerns that as a patient society what we have is that apart from the regular blood transfusions and the chelation therapy, we are also worried that this situation might escalate, the situation might go on for many months. And what about the monitoring and managing the patients on further than transfusion and iron chelation? So this is something that we have been trying to work with the ministry in order to include that in the contingency planning. And we as an NGO, we are trying very hard on this. So far, it has not been included, and we hope we have better news next time when we meet.
Thank you very much.
Can I ask you one more question, Jihan?
Yes.
You are a tourist dependent economy.
Yes.
Have the tourists stopped coming?
Yes, they have completely. We have closed borders. Yeah.
Thank you very much and well done.
Okay. Doctor again, please.
Who's the other one?
I hear that Shivneez is with us also. Shivneez, can you hear me?
Yes, I can hear you.
Perfect.
Hello.
Shivneez, you, if I remember correctly, you do not live in Male. You live on an island. Is that right?
No, I used to live in Mali, but last December my family decided to move to Malaysia. So my kids are now in school in Malaysia. And as soon as we came, the pandemic started and we've been locked down in Malaysia.
So you are now in Malaysia. All right.
Yes.
Can you tell us something about what's going on in Malaysia? I know that you are not on regular transfusion, are you, Shivneez?
No, I'm not on regular transfusion. But I've been in touch with my other thalassemia friends, and I have not heard of anyone who had COVID exposure yet. But I also contacted the Malaysian community, but we have not been able to meet up or start a conversation or introduce each other to since the lockdown started very early in January. We have yet to meet. But I would like to raise one more concern that I know Maldivian government is trying very hard and been working so well in organizing the strategies to make sure that everyone is included. But while I was talking with my thalassemia friends, many have concern that they have job insecurities because they are more immune, like they have less immunity to the virus. They fear going out to work. The government has closed down their working hours and people are staying home, but the private sector still is working. So they are concerned for their job security, and that is one main concern I was told when I asked some of my friends about what is happening in Mali right now.
Yeah. Yeah, job security is a very important issue all over the world. Is the national health system of Maldives out of pocket?
No.
Is it universal coverage?
There's universal, yeah. There is universal coverage in the Maldives, right?
Yes, universal coverage by, I didn't hear you.
Oh, in the Maldives, patients do not have to pay for any of their treatment.
Yes.
Yeah.
Yes.
Job loss is not a problem to the treatment of thalassemics. If they lose their jobs, they lose their, at least the medical, because
they're medically covered.
Yeah, because in some countries, if they lose their job, they lose their access to treatment.
Yeah.
Yes, I understand.
Okay.
I'd also like to add that even though I'm in Malaysia, there was recently care packages arranged to be delivered by the Foreign Ministry, and our thalassemia center allowed me to receive 3 months of medication of hydroxyurea. So at the moment, I'm covered for 3 months with medications here in Malaysia.
Yeah,
she's not.
Actually, this is excellent. I should tell you, Shifnees, that you should continue on your hydroxyurea, but remember that sickle cell has an increased vulnerability to the COVID infection. So please be extra careful in your movements.
Or in your first symptoms.
Yeah. But avoid too much social contact because we don't want you to get the coronavirus at all.
And I've been home since March 14th and I've not gone out. No, the kids have not been in school. We are doing online schooling and my husband is here with me. So for groceries and stuff, it is delivered to home. Yes.
So in Malaysia, they give three months. 3 months drugs.
Supply. Yeah.
Like in Calcutta. This is a program in Calcutta as well.
To Dr.
I did not get my medicine from Malaysia. I got it from Maldives. So there were care packages arranged to be sent to High Commission. So that the Maldivian blood services arranged for me to receive those medicines for 3 months.
Does she know what is happening in Malaysia a little bit? Did she tell us about the thalassemia in Malaysia?
It's not in this region.
Not very much.
Unfortunately, I have not been able to meet up with them. I only connected through Instagram, and we planned to meet up, but then there was first the influenza alert that went out, so we stayed home. Again, then there was measles alert, and again we stayed home, and then now COVID alert, so we've been staying home since for a long time now.
Okay, that's good. Shifnees, thank you very much.
Thank you for the opportunity.
Can we hear Paras for a minute?
Our Paras?
Yes.
Our Paras? Our Paras. Oh,
hello, Paras.
Hello, Paras.
Please unmute your microphone. Paras. Paras, do you hear us? Okay, let's move to until he fixes his. Let's go to Pakistan, Aisha Mahmood.
Okay, until we connect with Paras, can we hear from Aisha Mahmood?
Pakistan.
Aisha.
Hello, good afternoon.
Oh, nice to hear from you, Aisha. Yes.
Thank you so much, Steph, and thank you so much, Dr. Michael and Andrea, for the opportunity.
How is life for a thalassemia patient in Pakistan right now?
I have actually, as you know, that I'm leading Thalassemia Patient and Parent Society in Pakistan. So I keep on receiving all the news from all the corners of Pakistan. Currently, we are very well, doing very well actually, because we have suffered a huge shortage of blood since the cities were locked down and there were no camps, blood camps being arranged in colleges, factories, and everything. So we did the social campaigning on Facebook, as Sir Hassan Abbas and the other my fellows in India described as Facebook support. So Facebook has been a great help in this time, and we did the social campaigning. It got viral, and then the religious organizations and political organizations were involved. And right now, the centers are very have great amount of stock that can, I believe, serve till the first or the second week of Ramadan.
Okay. Enough stock to last until the second week of Ramadan.
Which is in May. The second week of Ramadan is in May, or yeah?
No, these days.
These days is the second week of Ramadan.
No, first week now.
Yeah, second week next week.
Next week, yes.
So really, until the end of April, that should say.
Is that right, Aisha? Until the end of April?
I believe so, because and that is also because in the major big cities, the smaller cities and the villages are still suffering, and they are relying on the replacement donors.
Yeah. Yeah.
Any infected patient? Any patient infected with corona?
Aisha, did you?
I did email actually. I have heard, or you can say read in the news, and a fellow from Quetta reported that a fellow traveled from Iran and died in Quetta. But I'm not sure. I don't have all the information.
But
a person traveling from Iran.
A person traveling from Iran.
Pakistan.
So this is a thalassemia patient?
Yeah, he was thalassemia patient, 13 years old.
How old?
20 years old?
13 years old.
13.
What happened? What happened to him?
I don't have the all the complete information. I just received it from a fellow. He passed away.
He passed away.
Ναι, αλλά το γεγονός ότι μας είπαν ότι τα νέα εγγράψαν ότι τα νέα είναι από το Pakistan, είναι ότι ήρθαν από το Ιράν. Κάπου αρχίζω να πιστεύω ότι είναι επιδημία στο Ιράν.
Επιδημία έπιασαν στο Ιράν.
Έπιαν τους, αλλά τους θαλασσεμικούς εννοώ.
Αφού έπεσαν αυτό.
Πεθάναν δυο και τούτος που ήρθε από το Ιράν, δηλαδή, από την Ινδία, that passed away, από το Ιράν που ήρθε, δηλαδή, he has traveled.
Okay.
So, πρέπει να δείξουμε ένα μεγάλο concern, χωρίς να το κάνουμε θέμα κυβερνητικό θέμα.
All right, sorry, we're discussing here a little bit about the fact that a patient came from Iran. So people who travel seem to be in more danger. And this actually justifies a little bit the restriction of movement. Yeah. Okay. Aisha, is there anything else for you to report?
Currently, there's nothing to report, as I have told you that we have faced terrible shortage. It is more likely to be get over. We might face another shortage in Ramadan, but hopefully all the religious and political organizations and social media will be helpful. One or two centers in the country were closed, but I am hearing that they are being operational again. Right now, the concern is the patients in the villages and cities are unable to travel to the main cities for their treatment. So they are suffering from like from the lack of facilities, and they have to get whole blood, or likely to be said manually made whatever, I mean, technically it is called that whole blood into RBCs. They don't have the component making machines and all.
Yeah.
Whole blood or no blood is given.
Yeah.
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 All right. What about, since we're in Pakistan, what about Jatin?
Thank you, Aisha.
Thank you.
Jatin, you hear us? Please unmute your microphone. Hello, Jatin. Do you hear us, Jatin?
How are you?
Yeah, hi.
Yeah, I'm good. First of all, thank you everyone, and thank you TIF for joining this wonderful meeting, and it's much needed right now.
Jatin from Pakistan.
Yeah. So, Jatin, you heard Aisha,
Yes.
I'm sure.
Yes, I heard Aisha.
What is your experience? Is it similar?
Yeah, doctor, much like similar, but I want to report that there are still shortage of the blood in like interior areas of this like Pakistan, like in the main cities. We have lots of blood. We got many blood from the Facebook, from the WhatsApp groups. We got the donors from this social media marketing. And but if we go in the like outside of the cities, where are small towns, there is still a shortage, and people are not getting blood, and they are surviving on 4 or 3 or 5 hemoglobin. So still there are big problem. And the other problem, which apart from this blood transfusion, there is a problem of chelation. In the Novartis, we cannot get the Desferol since like 1 or 2 weeks. They have shortage of Desferol, and many patients whom I know and who are registered with my organization, they are not getting Desferol anymore. So I don't know what is the reason why Novartis doesn't get the Desferol on time. So this is the problem. And also I know one patient who is thalassemia major, and he was infected with coronavirus, and with the blessing of the God, he is now much fine, and he's back to his home. He's discharged from hospital. So that's all I want to share with you guys.
Can you?
He has coronavirus?
No, one patient, he knows. But can he tell us where the Pakistan patients access their Desferal usually? Because in India it's NGOs and all that. In Pakistan, where do they access their?
Sorry, I didn't get you.
Andrullah is asking, where do people get their Desferal usually from in Pakistan? Is it from the pharmacy, from the hospital, from NGO?
It's like it's a mix up. Some patients get from the NGOs directly, and some patients buy from Novartis directly, and some of them patients buy from pharmacies where it is available, because Desferol is not a common drug and it's not available in every pharmacy. There are some pharmacies like in the centers of thalassemia, or where the thalassemia patients comes, like in Aga Khan or some other private NGOs. So they provide Desferol. And
industry, pharmacy, and from where else?
From NGOs, thalassemia centers.
NGOs.
Yeah.
When you say industry, what's the industry that provides Desferal in Pakistan? Is it
Novartis? Yeah,
Novartis.
Novartis.
Okay.
The one patient that he's reporting is not the one patient that who reported.
No, it's a different one.
So it's a different one. So
The patient,
we added up.
The patient had COVID? The patient himself.
Not this patient.
No, I know.
Yeah,
Coronavirus. So we have one in Pakistan.
Yes, but survived.
Survived, yeah.
But survive and been discharged and
Ah,
now well.
Jatin, we now see you.
Hello, Jatin.
Okay. Thanks for the information, Jatin.
Thank you, Dr. Michael.
We're trying to gather this information to get a picture of what's happening in the world and to see if TIF can respond to some needs.
Yeah, it's much needed. Much needed.
Yeah. Actually, we haven't heard from Bangladesh yet.
We don't have from Bangladesh.
We don't have anyone?
We have Nepal, but in Bangladesh,
Okay.
Yeah, Thailand we have just finished.
Well,
we are
so
done so far.
any of the we've really gone through all the patients except for Paras has not responded.
Paras is very
Paras, do you hear us, Paras?
Paras, what's wrong with him? He will be very distressed.
Try to unmute your microphone so we can hear you. Okay.
Did you send him a message?
Yeah.
Is he on?
He's on, yeah.
He's on. Oh, he will be very distressed.
Okay. So
finished.
If you would like, you can.
Just
if they have any.
I was sorry. Yeah, I was wondering if any of the patients that we've been talking to have any questions, either to us or to one of the doctors that might still be online.
Any questions?
No.
So keep safe with us.
Okay. Thank you, everybody.
So thank you, everybody. Indeed, keep safe. Keep well informed. Ask us questions. Concentrate information and knowledge is very important. And send it to us, please, so that